Another vaccine clinic for an underserved community almost got canceled by the state. This now has the governor's attention. A farmer and elected official talks about changing crops for the good of his valley.
We continue 20 years into really unprecedented drought and poor conditions.
And we remember how Coloradans learned about Pearl Harbor 80 years ago, including one family story of heartbreak followed by relief. Reports from Denver to Alamosa, Loveland to the Yampa Valley, and Berthoud between. This is next. Cases of the Omicron variant are not spreading quickly in Colorado, as far as we can tell. The state reported no new cases today. They do think there's some limited community spread, likely in Boulder County. That's according to examinations of wastewater, which we'll leave to that during the dinner hour. Hospitalized COVID patient count headed up again after some daily decreases to start December. 1,419 people are currently hospitalized in our state with COVID-19. It's up 40 patients from the day before. That's fairly significant, but we are down 47 patients from this time last week. State health leaders were asked today whether what we're seeing in that slowdown in hospitalizations is finally the boosters cutting into this surge. State epidemiologist Dr. Rachel Herlihy says they've been waiting on a large enough sample size to make that call.
The challenge is we needed enough hospitalizations to occur, enough cases to occur for us to feel confident that we had a large enough data set to confidently analyze. So I do feel pretty good about the data that we have at this point. One important thing to keep in mind, though, is that booster doses early on were primarily given to individuals who were immunocompromised, that third dose. And it's really difficult with our data systems to tease apart the immunocompromised individuals versus other individuals. And so as time goes on and we gather more and more individuals that have received a true booster versus a third dose because they're immunocompromised, we might actually see that gap grow even more, meaning seeing a clearer effect size from the booster doses.
I apologize. I couldn't suss an answer out of that either. Positivity rate is slowly headed down in our state. Our 7-day average of tests coming back positive is 8.2%. That's encouraging. It's the lowest we've been in almost 2 months. The canceled vaccine clinic in an underserved community in the metro area was not an isolated incident. After we told you about that one, we heard about the state bailing on another equity-focused vaccine clinic at Steamboat Springs. They cited the same issue, a lack of staffing. This time, organizers were able to scramble and work with the state to keep it on the books. Our Steve Steger asked the governor how the state plans to deliver on its commitment to make the vaccine accessible to communities where there are barriers and hesitancy.
It's like deja vu.
They had to cancel due to staffing issues.
Deja vu with a different ending.
We really appreciated CDPHE's nimble response to get vaccinators up here.
Routt County's public health director says she almost had to get really creative to pull off a vaccine clinic for the Spanish-speaking population in the Yampa Valley when the state health department staff wasn't going to be able to make it Monday. Too many sick calls. The same situation that canceled a clinic for Adelante Community Development over the weekend, a situation which the state called isolated.
With hundreds of successful clinics across the state, and the tight workforce issues we have, it shouldn't be shocking that there might be a time or two where people call in sick.
Democratic Governor Jared Polis answered questions about the Adelante clinic Tuesday, both in English.
What happened in that case is the staff called in sick.
And in Spanish.
Sí, quiero decir lo siento porque los médicos eran enferma antes de esta clínica.
He said a plan is in the works.
What we're working on doing is developing a reserve of flexible workforce that if staff calls in sick for a particular site, we could then send in that staff to make sure that it's fully staffed.
In Steamboat, Health Director Roberta Smith says the state health department switched gears, sending its vaccine bus instead.
They were actually here on Sunday, and Monday is typically their day off.
In the end, because of that flexibility, they were able to vaccinate more than 50 people and, more importantly, maintain trust.
Definitely in a small community, we are very close-knit and there's a lot of built trust.
The state health department told me in total 78 people were vaccinated, got their flu shots at that clinic in Steamboat yesterday. Today, the governor said that the state is working to schedule more clinics with Adelante, who you'll remember they canceled that clinic with this weekend.
Yep. So you've got trust issues and you've got logistical issues, as you know from talking to the organizers of the Adelante Clinic, the lengths that some of these families went to be able to attend.
Yeah, the thought is, we're talking about a clinic, in a couple of clinics. States had thousands of them. The reason why we keep talking about this is because in these communities, trust is so important. And sometimes people take a day off of work to go and get vaccinated. And if they don't get vaccinated and it's not available to them at that moment, they're not sure when the next time they're going to be able to get the vaccine is. We heard a story yesterday about a family, husband and wife, took the day off to get their boosters, and their 3 kids, their second doses, they weren't able to get vaccinated at that Adelante clinic because it was canceled.
Mm-hmm. Well, between you and our colleague, Luis de Leon, identified the issue, took it clear to the governor. Let's see that it gets straightened out. Steve, thank you. So CDOT has decorated the roads in lights for the holidays, those light-up signs warning about DUI enforcement, because Colorado is on pace for the most deaths due to suspected drunk and drug drivers since 2004. We've lost 221 people in those crashes so far this year. Safety improvements on the roads can help prevent some of those crashes, but the work is slow in happening. Our Marshall Zellinger explains why.
The sidewalk behind me for half a mile from 43rd and Wilson to 35th and Wilson did not exist. And it was the result of the death of our son, Gavin.
It's been 3.5 years since Melissa Meyer's 13-year-old son was hit and killed by a drunk driver in northwest Loveland, walking his scooter through a field on the west side of the road where the sidewalk ended.
Dirt path. It was a goat path.
This is how that side of the road looked until Melissa pushed for a safer route that opened this September.
Why can't we be more proactive is what I'd like to see.
1 month after Gavin was killed, City Council heard from the city's Public Works Department on what it would take to improve this part of Loveland. Option A was temporary, a paved path, termed a throwaway. Option B, also temporary, concrete that's not quite up to city standards, also termed a throwaway. They were called throwaways because if the city temporarily improved the area, City Council would lose the opportunity for a future developer to repay the city to build a permanent sidewalk.
They didn't want to put some of those scarce resources towards something that was literally just going to be torn out.
Mark Jackson is the Public Works Director who helped secure CDOT grant money to pay for part of Option C, a standard concrete sidewalk with landscaping and lighting, and eligible for partial reimbursement from a future developer for the city doing part of their work.
I would love to sit and tell you that we could go in and proactively fill every gap that we have, but there's just not the resources available for it.
Improving infrastructure takes money, whether it's a sidewalk in Loveland or a Denver intersection known for crashes, which is why these new traffic signals just went up at 5th and Lincoln and 5th and Broadway. Stoplights that went up more than 3 years after they were announced. A spokeswoman for CDOT's Department of Transportation tells me after the funding was secured, the design and build of the signals began, and that's when challenges were discovered, like addressing changes to the intersection's drainage. CDOT money was secured for both Denver and Loveland, but it got me wondering, if CDOT can award grant money to start a new project, can't it reimburse a city after the fact? A way to get work done faster? The simple answer from CDOT, if a city has the budget to already do a project, it can do the project. Grants are to help a city's limited dollars stretch over more projects.
I'd like to see a workflow and a process in place that helps all parties involved and make sure that change doesn't occur out of a tragedy.
For Next, I'm Marshall Zellinger.
The world changed 80 years ago today with the Japanese attack on Pearl Harbor. For families of service members at home in Colorado, quick news of the attack came via radio, was then followed by days of brutal waiting for any kind of news about their loved ones who were stationed at Pearl Harbor. It was collective concern of communities that played out on the pages of Colorado's newspapers. Craig goes to war. The local men listed as being in Pearl Harbor, though they didn't know it, had survived. Families waited days. It was 5 days later when the Aurora Democrat told of the first casualty notification in the Denver area. Russell Gallagher's parents were told he was injured. He did not survive. Aspen feared the worst for a local man on the USS Arizona, but Eugene Holmes made it. Tiny Bayfield, Colorado had 2 sons aboard the Arizona. It took days to learn that Harold Carmack and Gene Berry had been killed. Palisade lost Herbert Gagne. 2 weeks later, the family of Eagle County's Bernard Camp was notified that he had been killed. A week after that, at Christmas, the the Camp family got a letter from Bernard. He'd survived. He completed his wartime service and eventually came home to Colorado. COVID-19 mutations have been a source of concern. There's a chance it could mutate itself right out of existence. And hearing about the lack of snowpack and water issues in southern Colorado, a next viewer sends us to an expert down there to discuss whether there's something we all can do to help. Tonight's next question comes to us from Terry in Berthoud.
With Omicron being the latest of several variants to the original SARS-CoV-2 virus, I'm wondering how many mutations a variant has to have before it's actually considered a different virus. When does it become so different that scientists consider it a new virus?
We took Terry's questions to Dr. Michelle Barron, Senior Medical Director of Infection Prevention at UC Health.
So it doesn't actually have to do with the number of mutations. It's really what the function of the mutation does, and if it changes the structure or the function of the virus itself. And so you think of this as like you start with, I changed my hair color. Obviously, I look different, but it's still me. I changed my eye color. Still looks different, but me. But what if it's actually not me, but it's my cousin, or it's actually my cousin's cousin? And you start intermixing other genetics to where you're no longer, you may be related, but you're no longer obviously from the same family or from the same nuclear family. And we see this with viruses as well, except obviously they're not intermixing necessarily with each other, although they can.
Dr. Barron says you should really think of SARS-CoV-1, which has been around for years circulating. It looks very similar to SARS-CoV-2, and they're closely related, but they are two completely different viruses that she says likely evolved separately. Dr. Barron mentioned to us it's possible that COVID-19 is eventually going to mutate itself into extinction. That's something that can and does happen with viruses. Another question from your stack. Chuck says his booster shot and his wife's booster aren't showing up in the My Colorado app. You're supposed to be able to show that to get in places that require vaccines. He says they got their boosters 4 weeks ago. Still nothing. Chuck was curious how long it should take. So the state health department, Chuck, said hit the refresh button. That is actually what they said, but there's more advice beyond that. If refresh doesn't work and it's been at least 2 weeks since you got your booster, you're supposed to check with your provider to make sure that they submitted the information. Once they do that, it should only take 1 to 3 days to show up. Keep those questions coming. Send an audio or video version if possible to next@9news.com. Because if you're wondering, somebody else is too. Colorado's most important resource brings us together. No, not marijuana.
Whether it's the San Luis Valley, the Arkansas Valley, or the Western Slope, we're all connected to some degree by water.
A next viewer smartly wonders if those of us on the Front Range can do something to help our neighbors in drier parts of the state. We'll talk to somebody who knows a thing or two about water issues next. We're getting some feedback on our recent coverage of drought issues in San Luis Valley. Southern Colorado's concerning lack of early season snowpack was the topic of a conversation we had here with Chris Lopez, a journalist who grew up in the San Luis Valley and now writes about water issues there. Next viewer named John wrote in with a few thoughtful questions we'd like to explore. John asks what's being done currently in the valley to conserve the water that they do have in their aquifer. We asked Republican State Senator Cleve Simpson, who also helps run the Rio Grande Water Conservation District, and he said they've been going after it in a couple of ways.
Improving how we apply water to crops is, forefront in our efforts. That kind of coupled with, we're really trying to find different crops we can grow in the valley that consume less water.
To that end, Senator Simpson himself grows alfalfa, which he says is pretty water intensive. He's experimented with industrial hemp instead, which consumes a lot less water. Our viewer John was also asking if there's something that we along the Front Range can do to help. Simpson said he just appreciated hearing that spirit.
I expect the thing that most people can really do is really educate themselves and understand and know where their water comes from and understand the challenges that, other parts of the state feel that aren't always as present in, in the Front Range and the urban corridor.
Simpson said they would certainly welcome the support of Front Range Coloradans in supporting Western Colorado and Southern Colorado as they try to protect their water supply.
A nice day today. Temperatures were warmer, the winds were calm, temperatures in the 50s across the eastern plains. We'll see these numbers climb into the 60s tomorrow ahead of a storm, which will bring some good snow to the Colorado high country. Temperatures were mild through sunset with the high and mid-level clouds coming in. The snow will start to pick up in the high country tomorrow afternoon. A winter storm watch goes out for much of the higher terrain in southeastern Wyoming. By Friday, we'll be measuring the snow in the mountains at your favorite resort in feet, not inches. And Denver may get in on some of this action as we move into Friday afternoon. A dry day tomorrow. We've got snow showers coming in the afternoon. And on the future cast, we're kind of watching for light snow between now and Wednesday evening. And then it is Thursday into Friday. That's when Denver's got a shot at seeing some accumulating snowfall. Tonight, fair skies are low at 30. Tomorrow's high jumping into the 60s. And here we go. A nice warming trend until Friday. Our first official snow, we hope, with a high of 32 degrees.
It's a sign for you that a bulldozer's revving up its engine, about to clear away almost a whole block. Old Denver. That and your feedback next. It's a sign of a changing city. The 1000 block of South Josephine, east of Wash Park, looks like it's about to be transformed. Look at that, house after house of fences going up with construction and development signs all over the place. It looked to us like two houses next door to each other were prepped for flipping. There's a third house next door that's already in the process of being built. I mean, you see this kind of thing happening all over Denver, but usually it's one property here, one property there. That's like a whole block that's going down and coming up. Send us the signs you see around town, literal or figurative. Snap a picture or video and send it to next@9news.com or get our attention on Twitter with the hashtag HeyNext. Kelvin White writes in about Steve Stager's reports on some equity-focused vaccine clinics getting canceled for lack of state staffing. Kelvin says it's a shot. Lots of people have been trained to give shots. Yes, indeed. And Kelvin also notes that it's probably a paperwork issue. It is. Like the issue with the Adelante Clinic in Commerce City, they lined up some other people to give the vaccinations, but the state could not approve their paperwork in time. So that's why that event didn't happen. We're going to stay on the state to make sure that this kind of thing doesn't happen needlessly in the future. Emma Ray writes in to say, how fitting. Kyle is talking about wastewater, kind of like his whole show. Emma Ray, the word you're looking for is execrable. Execrable is the word that you're looking for. It's a great way to tell somebody that you think that they're without actually saying it. See you next time.